Evening, everybody. I am here and hopefully this will work tonight and stream into all the relevant places because we've been having issues. I'm just going to give it a few minutes for Facebook to do its thing and show you that I'm all here. And I'm going to just check on the other group while I'm waiting. I have two computers just to see that I am streaming, and then I can start answering your questions. Let's have a little look what's going on. Yep, I'm streaming, so we just need Facebook to start showing you all that I'm here, which sometimes takes a bit of time. And then I will start doing questions. Apologies that I didn't come on last night. Hello, everybody. If you could just give me a little thumbs up or an angry face or whatever you like, it just shows other people that we are here. I was just saying, sorry I missed you last night, but I went down for a quick drink to the pub and then met a friend and her boyfriend who I've been meaning to meet for about a year. And then I just thought, oh, I'll just take the opportunity to socialise, which I don't often get, but my children were away with their dad. So apologies. And then we met Father Christmas, who I'm sure is the real Father Christmas. If you have a look at the pictures, I haven't put one on the main group. I'll have to share the picture on the main group of the Father Christmas we met last night, because I swear he was definitely the real thing. And he had a bit of an accent, but he was doing the pub quiz, so perhaps not, because you'd think Father Christmas would probably be quite busy this time of year. So I've been busy today. I've been off to London for our Anaphylaxis UK trustee meeting. And it was very nice because we were treated to Christmas lunch by one of the trustees who's a barrister. So we went to something called the Temple, which you may have heard of, but I don't know that part of London very well. But it was apparently where Twelfth Night was first performed to Elizabeth I. I hope I've got the right person. And it was beautiful inside. And then a World War II bomb had gone and hit it, but not exploded. So they've rebuilt the section that was damaged just from the bomb going through. And the very long table we were sat at was apparently a gift for Elizabeth I, but had to be floated down the Thames because it was such a long piece of wood. And normally you have to be a barrister to go in there for dinner. So we were treated because we were with a barrister. And nobody warned me we were going anywhere fancy. So I was in jeans and trainers. But there you go. It was a very nice dinner. And we had a very productive trustee meeting. And then last week I was in London as well. And I shared a bit that I was there for the Anaphylaxis Business Symposium, which apparently the charity used to hold, but haven't done one for a while. And I thought it was absolutely a brilliant event. So there were multiple kind of businesses, so supermarkets, restaurants, and then like the Food Standards Agency. So we, as a couple of us, me and Paul Turner, who's an allergist, we kind of shared the background about where allergies sit. And I was talking particularly about the impact of allergies and sharing like your stories online and how it affects sort of every life event, really, as you all know. But many of these people, although their job is to kind of keep you all safe, don't necessarily have anyone with allergies, so hadn't really appreciated that impact. So although my talk wasn't meant to be emotional, some of them ended up crying. And then they started talking about the procedures that they have in place to keep you safe and the lengths that they have to go to check that there's not contamination, how they wash down manufacturing lines and things like that. And I thought it was fascinating because it's quite easy sometimes to sit and think not very much is being done, because we all get frustrated with all these precautionary labels that sometimes have relevance and sometimes don't, and the fact that some restaurants will say I can't cater for you, and all these sorts of things that add to the frustration of the allergy community. And yet actually behind the scenes there is a great deal of work that has to go on to make sure there's not contamination in manufacturing lines, and talks about how they can improve precautionary labeling, how they can improve menus and things. And it was really interesting to hear it from their perspective. So, and I was really hopeful that change is coming, and there's lots of meetings ongoing. It's just not an easy thing to change, unfortunately, with labeling, but there's lots going on, and I thought it was really interesting, so I thought I'd share that. So if you have any questions, pop them in the chat and I will endeavour to answer those. And I'm going to go to some that I think have already been posted while I'm waiting to see if any of you have any questions. Excuse me, coughing. I'm just getting over a cold. I've done really well this term to not get any colds until right at the end. But thankfully, I've recovered from this bout of chemo, and touch wood, my white cells that fight infection must be normal because I haven't become sick or anything. So that's good. But yes, I'm sure my children are trying to kill me with the number of bugs they've brought home this term. And my husband, who's not normally ill, but literally every time we've had a double bout of chemo, which is every 3 weeks, he has been really sick. So this is the 3rd time in a row he's been really sick, and he never is. So it just feels a bit unfortunate. I think he's doing it for the attention, but there we go. Right, let's have a look. So Julia has said, my son had a successful cashew challenge in the summer, and since then we've been giving him cashew regularly. However, admittedly, it's been about a month, maybe 2 months since he last had it. And today he had some on a corn cake and instantly came up with a rash and hives, very itchy, and also complained of stomach ache. Should we continue to give it more regularly or stop completely again? Feeling annoyed with herself because of the gap. Oh, this is a tricky one, really, because, you know, it might have been that I might have said, if you've just had a few hives, perhaps try again, maybe try a slightly smaller amount than you'd given, and just try it again to see whether it was just a contact rash or what was going on. But if he also complained of stomach ache, I use that as a kind of guide of severity, that it's a bit of a soft sign, really. It's not a definite link, but in the children who I've seen go on to get anaphylaxis, quite often they complain of stomach ache first before it's followed by a vomit, and then sometimes anaphylaxis. So for me, with that particular history, I would be saying, I think you really need to talk to his allergy team, unfortunately. I wouldn't be happy to say, go ahead and continue to give that at home. I think he probably, if anything, might need repeat skin prick testing, and then maybe even another challenge. And I get why you feel frustrated with yourself that there was a gap. But the reality is we don't really know whether it would have happened anyway, because if you have outgrown an allergy, then really the point should be that you can have it one day and not the next, and the time frames wouldn't matter as to how often you have it. And we don't really have any good evidence around how often you should be giving a food if they have seemingly outgrown it and passed a food challenge. And for instance, my son outgrew his milk and nuts, but for a long time when he outgrew the nut allergies, he couldn't eat them because he was so anxious. And so from 1 month to the next, he really didn't eat them. But now he is able to, because he's older and he can navigate it better. And he hasn't reacted. So I think this is just unfortunate, and may have been that he was going to develop it again anyway. So I think there's always a tendency to beat ourselves up as mums, but particularly as allergy mums. But really, that we don't have good evidence about whether you should have been giving it more regularly, and it might have happened anyway. But for safety, I think you need to speak to the team, Julia. I'll answer this one, so I'll mix between. Do hives always mean allergy? Our little boy's come up and down with small hives around his mouth a few times from peas, but no other symptoms. Antihistamines are not given and they just go away. Should we continue to give them? When he has them inside something, he doesn't seem to react, like in a veggie finger, only when directly on his plate. Interesting. Well, in terms of do hives always mean allergy? No, 100% not. In fact, more often than not, they don't mean allergy. So my kind of guides as to when it might be allergy are, if you're allergic to a food, would start around the mouth and maybe on the hands and then spread out from the body. They tend to occur usually very quickly after exposure to the food, but there can sometimes be some differences in time frame, and they often clear up quickly within an hour or two. Now, always there's some slight deviations from that with some people. So for instance, nuts like peanuts notoriously give a slightly delayed onset. So sometimes it's immediate, but I have known people where it comes on a few hours later and it's still a peanut allergy. But when you're getting huge plaques of hives, so really big like zones of it, often across the body, that last for like days, then usually that is a viral trigger in children. So you might find that they've got a cough or a cold or a fever, or even sometimes nothing obvious. But like if we all think about how often COVID would appear on testing, and yet someone's got no symptoms, exactly the same thing can happen for us with any illness, that your body could be actively fighting an infection. And we know that sometimes when our glands here come up, and all you might see of it is hives. Equally, more and more so, I think we're kind of recognizing that some children with very sensitive skin, with some of these foods, even like peanut butter, um, sometimes peas, all sorts of foods, when it just gets on the face, you just get these little hives, nothing else. Because if you had something else like tummy ache, vomiting, swelling, I'd be more mindful, but just a couple of hives. And so very often, like on the membership, people are posting and saying, I've just given some almond butter, for instance. They got a couple of hives. What do you think? And because I know those stories, because we have a one-to-one, I might say, okay, I think you should just keep pushing and try again. And then the next time it doesn't seem to happen. I often say try either a slightly smaller dose or the same amount rather than like go another step up. So it doesn't always mean it. And the other thing with allergy is there should be consistency. So it should really happen with every time you're exposed to the food, you would have a reaction. So the fact that your little one can manage it inside something where there perhaps is less contact rash, contact with the skin tells me that it probably is unlikely that they've got a pea allergy. There is something around thresholds. So it might be for some, and particularly around peas, I've seen it, that they manage like a couple of garden peas, but where there are bigger quantities of pea amount, like in pea milk, for instance, where there's higher pea protein, or trying to think where else people are reacting. I think it's the milks often. It seems to be a bigger amount and trigger a reaction, but people can tolerate a few small peas. And so where they are tolerating those small amounts, I'm keen to keep them in the diet to prevent anything more forming. So I think whilst it's only tiny amounts and he is tolerating it in other forms, I probably would keep it in. But if you ever feel that that rash is progressing or there's any other symptoms, then maybe you'll need an allergy test. Or if you're under an allergy clinic, then perhaps asking them to check it as well. Rachel, what have you said? Wanted to ask about the egg ladder, and do you think moving up to step 3 is the right thing to do? So had egg pasta and shop bought cake, tuck crackers, and touch wood seems to be okay. So many baked items have other allergens that you can't have, so a bit stuck, but don't want to rush either. So I think so. Always with these things, it depends on which ladders you're using. So I tend to use a sort of 3-step ladder where the bottom rung is all baked. So things like the fresh egg pasta, I think things like Milky Way bars is in there, and probably the crackers and the cake. And then the next step up would be what we call loosely cooked, but it would be things like well-cooked boiled egg, omelette, scrambled egg. So anything basically not raw, which would be the last step. So in terms of can you move up, my question would be, is this IgE or non-IgE allergy? Reminding you that the IgE is the one that gives you the immediate onset of hives, swelling, vomiting. In terms of if it's that, then if you're under an allergy service, they would be best to advise you, because they'll probably do tests, have a look at whether they think you can move up. A lot of allergy services now will not accept a referral for just an egg allergy, because we know that it's generally outgrown. So unless you've had a severe reaction like anaphylaxis, they will say, just have a look at introducing baked egg and then try to progress up the ladder every 6 months or so. So that's reasonable. And if you look up Wessex Healthier Together, if I I've done something fancy, if I just type it here, but on Google, if you put in egg guidelines, they've got some good guidelines about when good times are to move up on the egg ladders, and that's relevant for all of the people kind of down in the Wessex area, so Dorset and Hampshire and Wiltshire. We all use those guidelines, and I think even into Exeter. But there's no reason you can't look them up and know when to progress. And in terms of non-IgE, then yes, I'd be happy for you to progress up if you feel that somebody is tolerating that well. Wessex Healthier Together, by the way, it was developed down here, and now there are, when you click on the website, it will say, are you in Wessex or are you in some other area? So it's been developed for like London and a few other places, and it's a phenomenal website for child health. And I think there's some obstetrics stuff on there as well, so if you're pregnant, but it tells you things like fever and when should you worry for a child, what would you do with constipation, what do you do for diarrhea and vomiting, and it gives you some tips around some of the really common conditions that we see as as doctors for children, so that it gives you that empowerment back as parents. So it's a really good website to have a little look at. I'm going to switch back. I'll come back to you in a minute, Jaspreet. So, not sure if this is the right place for a question. It is. When would you consider a calcium supplement necessary? And if you would suggest it, do you have any products suitable for toddlers? So she's saying Albie's got IgE, milk allergy, and is 2, and has decided he no longer wants a bedtime bottle. He was on Mighty Pea milk, which contained calcium, but now refusing to drink it in a typical toddler fashion. Not a fan of yogurts. Maybe get him to eat once or twice a week. Won't touch porridge, so ready Brex out. Because if you didn't know from, and I didn't, but from Penny and Lucy's wonderful talks that they give us on membership, we've been learning that porridge can be quite good for calcium. Occasionally has a hot chocolate, but not a milkshake. He isn't a fussy eater, but he's a bit cautious. I do try and buy all his products fortified, but I'm not sure if I'm meeting his requirements. So always tricky, because I think, technically speaking, then where there's concern, obviously you should have an individual dietary assessment with a dietitian. But I fully recognise that even though that would be like the gold standard for children with allergies, it isn't happening as much as we would like, because there's just not enough of them. And certainly if Albie's got multiple allergies, or if there's any issues with his growth, then it would be very sensible to ask on push to have a referral. Usually the fortified, the milks, like your supplements, so oat milk, soya milk, pea milk, whatever you're using, would be fortified with calcium and vitamin D, and sometimes iodine, which is where you'd get it. And then you're right, some of the calcium content can come from other things, like I believe that beans, like baked beans, are quite good for calcium. So it might be worth just seeing if you could write a little, where are good sources of calcium, or have a look on Penny, who's the allergy dietitian on Instagram. She always does great posts, as does Lucy. But I don't think a supplement would hurt, to be honest, from what you've described. If he's not having any milk and you're worried that because he won't have yogurts and stuff either, he's not going to meet his requirements, well, it just wouldn't hurt. I will need to look up the supplements, because Lucy sent me a few recommended ones. So I will find out from them, because generally dietitians are great for advising you about all the right multivitamins, etc., to use. But I think it probably would be sensible from what you've described. I wish someone had told me that when I was breastfeeding and cut dairy out, that I should have been having calcium supplements. Didn't even have vitamin D, to be honest, because I don't know how well versed that was 14 years ago that we should be having vitamin D. And I've got a family history of osteoporosis, and now, of course, having chemotherapy that pushes you into the menopause, yay, at 42, but I won't be allowed HRT. So it really pushes up my risk of osteoporosis. And, it's all these added things that you might just think when you're breastfeeding, oh, well, I won't bother with a calcium supplement because I'm forgetting and it's not the end of the world. But actually, you can start to accumulate risks as you get older, because we're important too. Because one day your children will have fled the nest, and it will just be you with your own health and wanting to be fit and not in pain. And if you smoke, that increases your risk of osteoporosis. It's better to exercise regularly, that helps. But if you've got family history, and as I say, if you have early menopause, all of those things add to increased osteoporosis risk, because we know that if you have less estrogen, that increases the risk. So people who have early menopause should normally be given HRT to protect them against that. Megan said, excuse me, I need water. Hovis Best of Both bread has amazing levels of calcium in it. There you go. She's just checked, and one slice has 143 milligrams of calcium in. And that's why these groups are such a fountain of knowledge, because we can all share the bits that we're good at. So maybe try some Hovis Best of Both, because, frankly, it's easier to remember to factor in some food into our daily lives than supplements, which I'm a bit rubbish with. So what have we got? So my son's had some gingerbread biscuits with egg in it. I gave it to him for a day and no hives, and his nappy seemed to be okay. 5 days later, I gave him a tiny piece of French toast and no hives either. But he's done 3 soiled nappies today with a slight smell of vinegar, and they're brown. Not sure if related to the egg intake or if it's because I ate a muffin with milk. Either way, he seems to be eating, so should I continue? And I know, because I know this story, that we've had some concerns around eating. So it's anxious not to knock things off. This is always going to be the problem. And anyway, because we're constantly saying with the non-IgE allergies, where we just do not have this test that exists, then sometimes we have to just keep pushing or try something again until you get a real definitive answer, particularly when you're doing re-challenges or you're trying to reintroduce these foods back. Is this definitely causing a problem, or is it just the case that they've now got an illness, or they're teething, or they've had their vaccines, or it's a funny 5 minutes? And so quite often people will, and I use the membership because there's so many weaning mums on there and going through ladders, that they'll say, we've had slightly less nappies today, or we've had a few more, what do you think? But it's been not enough to go, yeah, I've got a real feel that this is definitely not tolerated. And because it makes such a difference to everybody's life, if you can start getting these ladders in, I often just say keep trying again. So I think, given that, I mean, obviously the French toast really is slightly more, or slightly less well cooked egg than the gingerbread biscuit, which would be definitely baked egg, but the French toast might be creeping into the second rung of the ladder. It could be that it was the French toast, but I'd perhaps say check things have settled again. Maybe just keep the egg in and figure out where things are going with that before you add in the variable of you having the muffin with milk, unless that's new. So figure out which way around you were doing it, but try and only have one variable that you can analyze. Otherwise, it makes it very difficult and you'll end up pulling at both of them back. So try and finish one ladder before you introduce another, or at least know how far along a ladder you've got before you start another one. If that makes sense. You can always message me about it and we'll have a look. Emma. Oh, a long one, Emma. Okay, 4-part question. My son has a non-IgE allergy to milk and soya. I had a dietitian referral at 6 months and emailed the ladders and told to start them at 1, and the milk one at 1, and then the soya when he's past the milk ladder. Then they discharged him all over a phone call. Typical, isn't it? That's always the way, and it's really hard. And then had a really tough time between 8 to 16 weeks because no idea what was going on, and got to the point where he wouldn't feed because he was arching his back, etc., and dropped his centals. Now back up. So typically reacts on day 3 with an explosive large bowel movement. Hasn't happened for quite a few months, and is a reaction through my breast milk, as he's never been given milk or soya directly. At what point would you stop a stage? Should we continue if symptoms are mild, or stop and leave it 3 months as soon as he reacts? That was just what we were kind of just saying. So I would stop where you are definitely sure that there's nothing else going on, and it is absolutely that. So I guess you know that you're waiting for that 3rd day. If it's just one explosive large bowel, but he seems otherwise fine, given that with non-IgE allergies, generally we've been looking for 2 features. So if also he's in pain, reflux again, so arching his back, maybe rashes are flaring up, he's really congested, then I would stop. If you've just got one explosive bowel movement, maybe could you just keep with doing however much you introduced at the same amount for a little bit longer, just to see, do things deteriorate or do they actually get better? Because also, if you bear in mind, because they're not used to these foods, sometimes they have to learn how to process them as well. So I think I would keep going until you see 2 features or something really definite that it's just absolutely not right, it's not going to manage, and then try again in 3 months. And if you, once things have then settled, if that was the baked milk you've tried, there's no reason you couldn't try baked soya to see, actually, is that tolerated before the baked milk? So you don't have to have finished one before you go to the other. And I always say to families, which one do you want in first, the milk or the soya? Because we've all got different opinions about that based on what, as a person, you find more restrictive. And many people say they find soya harder than cow's milk. So that would be fine to do it that way around. How long should we spend on a stage? And if he reacts, should we continue on that stage until symptoms settle or totally stop? So in terms of how long to stay on a stage, there's no real right or wrong with the non-IgEs. Sometimes I whip quite quickly through every few weeks if you're happy that things are progressing and you feel quite confident. So if you've got that stage in and you've done a couple of weeks and everything seems good, there's no reason you can't try the next stage and see whether that's also successful. And in terms of the symptom setting, that's what we sort of talked about. If you give it a little bit of time to see if this calms down. If not, and it's getting worse, then stop and pull back and go back to the step that was tolerated. We were at a friend's house 11 days ago. He picked up my friend's sippy cup, not her friend's, her child's, containing formula that was left at his level, put it to his mouth just before we grabbed it. Don't know whether he had any, but he reacted on day 3 with a loose movement and then another loose movement on day 6 or 7. He's not had any other symptoms and hasn't had a bowel movement since. Before we knew he had allergies, he used to have bowel movements infrequently, and it's only become more regular in the last 3 months. He now normally goes every 3 or 4 days, and it's always solid since eating solids. Should we delay starting the milk ladder because of the reaction? No, I wouldn't, because who knows whether that was something or not, but also that was just pure milk. Whereas there's no reason that just because he's reacted to that, even if it was just a trace amount, there's no reason he wouldn't then be able to go on and tolerate a baked milk. So no, I wouldn't delay it. So once things are settled again, I would go back to it. Do I stay dairy and soya free whilst doing the ladders as I'm continuing to breastfeed? And then do I do a ladder once he passes the stage? So yeah, normally we would say once you're happy he's completed stage 1, say, then you put it back into your diet. So you stay one stage behind the little one, and that seems to work quite well for most people. And Helen has said, should soya lecithin be avoided when following a soya-free diet? No. And if you look at the guidelines, so we use the IMAP guidelines, the International Milk Allergy for Primary Care guidelines for non-IgE. Actually, it says advise mums to avoid like soya in its main form. So don't go for soya milk, soya yogurt, but could continue to keep soya in the form of soya flour. So in like sausages and bread, etc., which is interesting because the majority of people I would come across would be feeling that what doesn't help matters. Nearly everybody would tolerate soya lecithin. I know within the group and within life, there are people who will say that there are issues, but I certainly would be seeing whether soya lecithin is fine. It might be that the reason people are reacting to soya flour, etc., is because you don't really give it long enough. So you could just reduce the soya out of your diet for a couple of weeks, but without taking the soya flour out and then seeing how things are. But of course, everybody straight off would rush to take the whole lot out, which I understand. And I don't think we're going to change that, to be honest. So, but the guidelines say keep it in, but it doesn't matter. But soya lecithin is not likely to be an issue. Hi, Megan. Yes, so I've been reading. So you've been offered, or not you, your daughter has been offered milk immunotherapy at St Thomas's. And for those who don't know, Megan's posted a few times because her daughter's been really struggling at secondary school with having reactions seemingly through the ventilation system in the school, which of course is very hard to ever prove because I don't know how that would be measured. And of course, the school aren't going to invest in whatever technique you'd need to find that out. But noticing that when your daughter's not at school, she's not reacting, and you've now spent money, I remember you saying, on filtration systems to try and help in her classroom and stuff, but she's already missed a lot of school. So the hope would be that by having immunotherapy, you're trying to make people safer. This is for the benefit of other people, to mean that if they were accidentally exposed to the food that they've had the immunotherapy to, they should be able to tolerate a relatively low amount. So for instance, with the peanut that I do, by the end of 6 months of treatment, that person can eat 2 M&Ms every day. That's the peanut M&Ms, and they don't react. And actually in the studies, it showed they could tolerate more, like I think it's 10 to 12. But we don't say go out and eat as many peanuts as you can. But what it would now mean is you can eat like all the foods with precautionary labeling if you weren't. And that if you were in a restaurant and someone accidentally put peanuts in your food, you would no longer be likely to react. So it keeps you what we call bite safe. So the point for your daughter particularly would be that we would hope that these horrible environmental the airborne reactions would stop. But they have advised you, I recall from your post, that she shouldn't be at school during having immunotherapy. We'll probably have to do some homeschooling to avoid the reactions. In the blurb, it says they like the child to have started the milk ladder. But clearly can't go anywhere near the milk ladder. And she had anaphylaxis from baby sick on her skin. So super sensitive, even from, I don't know if that was from an early age. And the hospital knows it. And you were just saying they've booked a £10,000 service clean of the entire ventilation. I mean, wow, that's incredible, isn't it? I'm impressed they've done that. And I think that shows how seriously they've taken it and your tenacity for continuing to go in and advocate for your daughter. So I think that's phenomenal. Why do they want you to not well, that's interesting about the milk ladder. I certainly wouldn't want you to try the milk ladder personally at home without having a hospital food challenge. So I think you need to talk to them about that. I think that's not going to necessarily be likely that she could do it. And when you think about immunotherapy, for many people, the whole point is that they can't actually get onto the milk ladder. That's why we're trying to sort of start desensitizing the body really against it. But I think why they might want her to be away is that what we know is with the immunotherapy, we are deliberately giving you a small amount of the thing you're allergic to every day. And therefore, we don't want to risk that you're also getting added exposure from another setting that might then be more likely to tip you into anaphylaxis. Because any immunotherapy process has set rules around it in terms of you can't exercise for 3 hours, you can't have a hot bath or a shower for 3 hours. And that's because we know for anyone with an allergy, it's more likely to trigger anaphylaxis. So I think they probably don't want to risk anything where she's going to be more likely to be tipped when they know she's already going to be what we would deem as a high risk person to be doing this on. So I think I'm hoping you've got a conversation with them to discuss all of these points further and to really get a feel of whether it's going to be right for her. But I think if it works, it could really change her life particularly. And these are the sorts of people where, the immunotherapy is really the sorts of candidates we want to be offering it to, because it's going to be the most life-changing because they are so reactive. They only do day 1 in hospital. It's interesting, isn't it? Because the immunotherapy is all like very different across the country. And of course, most of us don't do milk, and there's just a few centres that are trying to do it and see how far they get. Oh, hello, dog. Just kicked the dog accidentally. I would hope you'd have a really close contact with people in hospital to help liaise and support you. And as a little plug, whether joining the membership so that you've got some daily support from us through it if you ever need to, that in the membership we have quite a lot of people who've chosen to go down immunotherapy on the private route. And whilst really that's up to their centre to be supporting them if there's a problem, is not unusual that they pop in and say, what do you think? And I say, well, obviously tell your centre, but this is what we would do. So it kind of gives you someone as a support. 1/20th of a mil. It's going to be challenging. You're going to sit in the car park. I totally get that. I think it'll be brilliant. You have to keep us posted. It's going to be a long process, but I think she's the right person to do it for. And if it helps, if it was my daughter, I'd 100% do it. Let's go over here. Amy has said, hello, hope you're okay. I'm doing really well. I had to have a chat with my oncologist on the train today. That's embarrassing. But anyway, we kept it short. I had an inkling my 2-year-old daughter was allergic to walnuts, but a skin prick test indicated she wasn't. She had walnuts by accident months later, and her face swelled up so much overnight she was barely recognisable, but otherwise fine. What would the next steps be? Just avoid them further or have some more tests? That's the first bit. So what we'd always say is, if somebody's given me a really good history of an allergic reaction and one test is negative, I'd always be doing the other. So if a skin prick test was negative, I'd be doing a blood test as well. Depends on the age that you've done a skin prick test, because sometimes in the littlies, so the under ones, it's not unusual that I'll see the tests be negative. And I had this on one of the ladies who had she was a doctor, and everybody was doubting her that her child was reacting because the tests were negative. And she went back in 6 months and they'd all become positive. And thankfully, she'd been avoiding the foods for that child in the interim, because sometimes it just takes the skin time to catch up, to start having that local response when the allergen is put on and the skin prick test is done. Sometimes the blood test will be positive sooner. So for me, I would have done the blood test. With what you've now described, typically an allergic reaction, as I've said, would have come very quickly after exposure to walnuts. And normally I would have expected that the swelling would have settled down within hours. If that is the case, then really you need to reconsult somebody. They need to repeat the skin prick test. And if it's negative, I would still want them to do a blood test. And if that's negative, sometimes there's still arguably a question of, should you have a food challenge to prove one way or another in a safe environment? Was that definitely the walnut that triggered it? Or was it something random like a virus? Or some people, even littlies, will get random swellings and hives because their body's just exploding the chemicals, the cells that contain allergy chemicals, but without an allergy trigger. So yes, that needs reevaluating. Also, a few times we've been out for dinner, and if she eats breadcrumbed mozzarella halloumi chicken, she gets a red rash on her cheek and chin and cheeks. She's intolerant to egg, but not allergic according to the skin prick test. But there was no egg in the dishes. So some children, particularly if there's a little that's got eczema or sensitive skin, will just get very rashy around some food. Chicken is quite an irritant. I said this on to the members the other day, because someone was asking me their child had a bit of a red rash, and I was sort of reassured them, because I find chicken incredibly irritating. So I've got quite sensitive skin, and when I cut it on a Sunday, my God, the itching. I have to really scrub my hands because I almost can't bear to cut it. And so some children will just have a little red rash, and as long as we're not talking hives, it's likely these are just contact rashes. So lots of foods just naturally have chemicals like histamines in, salicylates in, they're just irritants. So as long as they are not hives and they're just kind of a nondescript reddish rash that doesn't really bother them, and there's nothing else, then generally that is just an additive or something in it that's just triggered a bit of a rash. And invariably give it a year or two and it will stop happening. My littlest one was like that. She just rashed up all the time, never bothered her. She also had a bit of background eczema, and then by the time she was about 4, it just all stopped, and it never happened again. But we get loads of referrals for people saying allergic to ketchup, allergic to mayonnaise, but actually can tolerate all forms of egg, because mayonnaise often has raw egg in it, barbecue sauce, and it's always the histamine component of it that triggers the reaction. So that one sounds okay, but the walnuts need to be re-explored again, I would say. Looking for questions. That's those questions. I'm going to have a quick squiz through the group. Let's have a little look. I've seen some terrible eczemas again on the group. Always really frustrating. And then I saw can't remember your name, Emma, saying that her GP swapped her Humavate to Adjuvate, which is a similar strength. Well, it is the same sort of strength, and it's because at the moment we're really struggling with availability of steroids, which is really unhelpful when we've got a third of the population suffering with eczema, and we use steroid creams for other skin conditions, of course. And it drives us nuts as GPs, particularly, or any doctor really, when pharmaceutical companies have issues with manufacturing drugs, because no one tells us. So we prescribe it, and then eventually the pharmacist sends us back and says, prescribe something else, but no one tells us what else is available. And it can mean that you as a patient go round the houses trying to find something helpful. So it's not very good. As there's no wheat ladder, what's the best way of starting trialing it? So different dietitians will say different things about this. I think Penny says to do it as like tiny bits of bread, assuming that there's nothing else in the bread that little E is allergic to, or adult. So I think she sort of suggests cutting it into strips and trying like really minuscule amounts, and each day, or if it's a non-IgE allergy and you're waiting 72 hours, then doubling it after that. So you could divide it into 8, and then the next time have 2/8. Another dietitian I worked with suggested using pasta. So you make your normal pasta dish and you just have one pasta shell that's wheat-based, and every few days you start increasing the amount of pasta shells to see if there's a problem or not. And generally, people will start reacting quite quickly if they're still intolerant, even at the low levels. So if you've got, some bread in with success, then the hope would be that you'd be able to persist through putting it all back in. But yeah, the evidence around the ladders is only really for milk and soya and egg, in terms of cooking it in those matrix, which change it slightly and make it less reactive. And in other forms, then sometimes we just start small. I know people have asked before, like, is there a ladder for legumes or peanuts and stuff? And there isn't, but you can just use common sense and just start with a quarter of a teaspoon, a half a teaspoon, building it up slowly like that. I have a lovely lady coming to see me in clinic tomorrow. Anxiety around allergies persists, not just for in childhood. Unfortunately, it will often persist through into adulthood. So she's coming to sit with me to eat the thing that's causing just oral symptoms. So it's not causing a true allergy. It's pollen food syndrome, which, if you haven't heard about, is these cross reactions that can occur usually in an older child. So it classically, you'd get hay fever, and it's usually with tree pollen. And that classically happens in late primary school, although I'm definitely seeing it younger and younger. And then, yeah, I have answered your question, Amy, but I'll just briefly say it again. And then, yeah, so you start to get your hay fever late primary school, and then you start to develop pollen food syndrome, often as sort of a teenager or a young adult, and you can get more and more. And essentially, it can be because fruits and vegetables and some nuts, not cashew, pistachio, or Brazil nut, in their raw form look like you're eating pollen. So it gives you a really itchy mouth, sometimes a bit of lip swelling, and sometimes a rash just here. And if you cook that food, so you now have, say, if it's apples that trigger it, and you have apple juice that's pasteurized or apple crumble, the protein now looks different to the body. You don't react anymore because you weren't truly allergic to apples. It was just in their raw form, it looked like pollen. And sometimes the test for apple is positive and sometimes it's negative, but it's all based on the history. And the history should be that you definitely test positive for pollen, that usually you used to be able to eat those fruits and vegetables without issue, but that you can eat them in their cooked form. And as long as you are, this is a generalization, usually UK born and raised people react to the type of protein that would never trigger anaphylaxis, but that is changing a little bit in the UK. And we can tell that a bit with some specialized testing, but the classic history would be only oral symptoms. The moment someone tells me that they've had widespread symptoms, so a widespread rash, tummy pain, a vomit, anaphylaxis, this is not a benign pollen food syndrome. It needs to be taken more seriously. Or the moment that someone tells me they react to cooked fruit and vegetable as well, then this is a different type of allergy. And there are some newer allergies emerging linked to pollens called lipid transfer protein that cause more severe allergies. But this particular lady, I can tell on her blood test, has specialized nut testing, that she's not got a true allergy, that nothing's going to happen, or possibly an itchy mouth. But she's avoided it for so many years based on a maybe it did something, that she just wants to come and sit near me. So bless her, she's doing that. I mean, in response to your answer, but literally, if you think about the timing, we've been on for 45 minutes now. So if you watch from about 35 minutes, you will see. But essentially, I said the rashes with the foods are really common, and it's probably just things like histamine in it or a contact irritant. And it will, as long as it's no other features and not bothering her, she'll grow out of it in time. In terms of the walnut, 100% needs a reassessment with a repeat skin prick test. And if that's negative, a blood test, because sometimes as an early age, the test can be negative because it just hasn't started to show up yet on a test. But if there's a clear history of reacting, then it shouldn't be given again. But watch the full answer, because I gave you a full answer. So probably from around 35, 40 minutes later. I have a question about almonds. We had to introduce almond at home, and the eczema on the back flared up. So we paused for a couple of days, got it under control, and have given it again. And the eczema's flared up again. This is directly on a spoon, mixed in yogurt. Yeah. As she had a couple of hives when she had it on toast again with this contact reaction. Is this a sign to give a bit less than a teaspoon, or to keep going and accept the eczema? We already use Elidol and steroid cream if it gets quite, hang on a second. The annoying thing with StreamYard is it doesn't show me the end bits of a long question. If it gets quite bad, although I feel at a loss because the skin's been so controlled, I don't want to go back to being challenging. It's really difficult, isn't it? Because when you've had really difficult eczema, you really don't want to be triggering it in any way, particularly when you can see that something is directly exacerbating it and you've done the right thing and you've tried more than once. But my worry would be that we know that the group of people who are more likely to lose tolerance and develop IgE allergies would be the children with eczema. And almost the fact that it's kind of flaring it up makes me anxious that if we pull it out, there might be a complete loss of tolerance. So having done this quite a lot and worked with other people, if you can keep it in, generally what starts to happen is the eczema actually settles and the body starts learning to ignore it. So I've done this before with other people, particularly around soya, that seems to also just flare up the skin. But you keep pushing, you keep treating the eczema, but keeping it in. So don't pull back, wait for the eczema to settle and then put it back in. Keep the spoon in every day, keep treating the eczema and see whether it will come under control and sort of settle down in a week or two. If it's really flaring up, it might make life too tricky. So just reach out to me again and ask. But ideally, I'd worry if you pull it out altogether, there might be a complete loss of tolerance. So ideally, if you can keep it in, usually in my experience, the skin starts to settle, particularly if there's nothing else and no gut symptoms or making us think there's any other type of non-IgE reaction going on, although that is less likely with nuts. But and someone else saying we have the same issue with peanut. So a peanut 100%, please try and keep it in. So we really have that big bulk of evidence from the studies that if you have eczema, you've got a really much higher risk of having a peanut allergy. And in the children where we were able to get it in and keep it in 3 times a week till they were 5, their risk of developing a peanut allergy was 10%. So it can still happen, but it was as opposed to 35% of children with eczema who didn't have regular peanuts. So if it's flaring it, and I know there's somebody else, I don't know who that person was, Grace, but there's somebody else on my group where it's the peanut is flaring the eczema. And I'm really trying to say, let's keep treating the eczema, keep putting lots of thick ointment on, like the hydromols or the 50/50s, keep moisturizing loads. It usually does settle. So as long as there's nothing else, keep pushing so that we don't lose that tolerance. If it takes longer than a week or 2, would you say that maybe pullback is key? It's tricky. Oh, tricky. She's also had some vinegary poos, but it is hard to know. Yeah. So I'd be looking for, I'm not so bothered about the smells because I think that can just come up and down and really change with new foods, but I'm looking for frequency or signs that she's in pain. It's also winter as well, and that's added in with the eczema. I'd probably want to see what it's looking like if in a couple of weeks it's not settling. So perhaps if you didn't mind either DMing me or popping a picture on, but making sure it's got nothing to do with bottoms or any exposed bits, because Emma, my VA, has a fit and messages me because Facebook will shut us down. In fact, I've had some really dodgy messages recently from Facebook saying, we're going to close you down, but they're just spam. But I keep going, no, I've got all these people. I'm answering questions. So we're really trying to keep the group alive and open by adhering to Facebook rules really strictly. So yeah, just DM me a message if you're not sure. Usually it does, fingers crossed. Usually it settles. And it might be just we need to do it in, every 3 or 4 times a week with the almonds. That would be reasonable to do. See how you get on. Fingers crossed. No worries. Yeah, do send me a message. Let's have a little look through. It was interesting because I was chatting to an allergist the other day and he was saying that he was thinking about trying to get some, I know, so many allergies, and trying to allergens to work through, and it's a pain in the neck, and hence the less allergies you have by trying to get them in, the better it is, really. But he was saying about trying to think about getting some funding to sort of do some weaning support groups. So I sort of said, I wonder if you realize what I've been doing with like the membership and trying, and that's exactly what we've been doing, is trying to support people. But in my own mind, to share my kind of business thoughts, I've been thinking about how can we support areas of the country which are really poorly served by an allergy service. So Scotland, Northern Ireland particularly, and South Wales not so bad, but North Wales really tricky. And thinking, could we work with the NHS in some way to say, we have this group, it's very supportive, we can help hold people's hand when they're not getting the allergy service. But then a bit of me was a bit like, will I be flooded and not cope because of the numbers that I know that are not being served? But I do think in the allergy world, we need to be trying to think more laterally about how we can support everybody out there, because the NHS service is just not good enough. It's not fit for service for anything at the moment, but it's just not fit for service for people with allergies, and is not likely to change because there's been so many reports that have been taken and written to the House of Lords repeatedly showing the allergy, the unmet need, that's what the reports are called, and how there are not enough allergists in the country, how that needs to be expanded, more specialist GPs like me. And absolutely nothing changes, and they just don't seem to have any motivation to change it. So many of the allergy sort of doctors and things are trying to really think, how can we support you in different, more lateral ways? And in fact, that was one of the things we were doing with the charity today, is thinking about how can we provide support in other ways for people So yeah, so if you've got any brain waves of thinking about how can services evolve, what areas did you struggle with? Do you still struggle with? Have you got any novel ideas, and share them, because that's we can only hope. And I'm hoping to um, prove and show with a study how the membership has worked very well for providing psychological support for people with allergies, but also that all-rounded support that you need to empower you with the knowledge that we try and do on these events, and to push people through weaning and introducing foods, to show that maybe that could be mimicked in an NHS setting, that your allergy clinics that you're under could provide more continuity of care by having somebody come online every day, as I do in the membership, to answer big questions that people have, because they will have access to your notes. You then, as a community, could support each other, and you're local in that area. So I think it's got some really lovely ways it could work locally from a service, with not too onerous an amount of work, in my opinion, because often you all answer each other with correct answers. So yeah, watch this space. That's my plans, to try and show how, yes, this has been private, but that actually how we could put this into an NHS setting as well. But we'll see. Anything else? Yeah, I wouldn't get so in our allergy service in Southampton, I say our because I'm sort of still linked to them from the Palforzia, but I don't work for their NHS service anymore. But our allergy nurses were phenomenal. But I know that they always used to say to me, so they go in and they answer they've got an answer phone full of messages from people ringing to say, I don't know, I'm not feeling very well today, should I turn up for the food challenge? Or this has happened, or this school won't do this, or all sorts of issues that that you face every day, that we see the questions of here. And they would answer them, but they would always say to me, we have no time factored into our day to be doing this. So they're not being paid appropriately. They're doing their full connects and all their day ward stuff and everything with no time factored in, and finding that a real challenge. Whereas arguably not listening back to all the phone messages and just logging on online in a secure platform, and it doesn't have to be Facebook, because that is open to you just being shut down and confidentiality, etc. But I just think it could work really nicely, that you could have somebody go in and do it that way. That's my personal opinion, but whether it'll happen, I don't know. But I do hope to sort of show some evidence about how it works and take it to conference, so we'll see. Any more questions? Otherwise, I'm probably going to love you and leave you and try and get Gigi to bed. Just before me, we had Dr. Francesca who's our clinical psychologist. She was just doing her module on learning how to eat out, because one of the things I find so often is that people will come up to me at like the events when I'm at a free from show, or they'll message me, or they'll come here and go, oh, allergies have ruined our life. We won't ever eat out. We don't go on holiday anymore. And as you know, that my real feel is why I set this up in the first place. I want people to learn how they can manage it and navigate it and live as well as you possibly could. Very challenging in Megan's situation when you've got these airborne reactions, but there are still ways. We supported somebody to go on holiday on a plane. So yeah, her first module that she just recorded was about how to have strategies to eventually get to a place where you could eat out. And that is also for the young person, because sometimes it's them that's really struggling. But all of those modules that are for sale now are dietetic modules, skin modules, mine, an adult, one on irritable bowel at the moment. They're all on the website. So you can just find those, the membership, the expert speaker talks. And we are in January going to have, after our talk from T about allergies with teenagers, then going to open it for the next hour to try and see if any of our young people want to come online and share. And I know that's going to be tricky, but we will see whether we can arrange an online meet for our young people to give them a bit of support. Help, we have Finley's peds appointment tomorrow. I'm told he's also an allergy doctor. He probably is. And he's going to push us to try more food trials on the ward. He's already had anaphylaxis to salmon at home. First ever 25% cod fish cake on the ward, 25% haddock fish cake on the ward, tuna on the ward. We've decided as a parent not to trial anything else they offer. Are we doing the right thing? I'm just trying to read that again. So had anaphylaxis to salmon at home. And then because I think I remember this story. Let me just go onto my streaming and I can see your name. Because unless you register with StreamYard, I can't see your name, but I might remember Vicky, I think it was. And did he then, am I right in thinking he's had reactions to the cod and the haddock on the food challenges that were quite significant, and you kind of feel that at the moment it just doesn't feel right for him to be pushing on with anything else? I think that's, if I remember that story, is that right? And in which case, there is no right or wrong. Sometimes I have sat in meetings before. Yeah. See, I'm good at stories. I'm rubbish at names, but I am good at stories, and I'm rubbish at faces too. I always say to my husband when we're out and about, I just say, they ask me their name. So he always says, "Hi, I'm Gareth," and then they introduce themselves because I'm rubbish. My brain's too full of other mental things. Yeah, so I have sat in meetings before where, in fact, I was chatting to a colleague about it the other day, and she was of the same vein of me, where they might be highlighting that they have real anxieties that this parent won't reintroduce something or do food challenges or whatever. But it's nearly always done from a place of trying to keep that child safe, of not traumatizing that child, as we know can happen when you're having repeated food challenges and you are reacting each time. That young person will often remember it, and that's very difficult if you're the parent that you've tried to convince them to come in and have a food challenge, and they trust you to do that, and then they're reacting, and then I think you feel difficult of how would that young person feel towards you, putting him in that situation. So there's just always so many things to weigh up. And so I really just feel that there is never a right or wrong. And I think as long as it's coming from a good place as to why you wouldn't want to do it, and not, somebody really weird who's I don't know, getting enjoyment from their child having the labels of allergy, highly unlikely. But there's a very small proportion of the population who have some funny health conditions. But in this situation where he's reacted to so many things, I do get it. And sometimes I think it's very reasonable to wait until that little person is becoming a person in their own right to say, I would like to do it again, or thanks very much, but actually I'd rather not eat fish. And that's okay. I have plenty of adults who have got multiple restrictions where I say to them, like, I really think you could eat X, Y, or Z. And they say, I have no interest in eating nuts again, even though you've told me I'm not allergic. I've avoided them my whole life. It will create too much anxiety for me. I don't want to. I've declined a food challenge. That's okay. And if you feel at your position at the moment, the right thing for you and your family and Finley is that he shouldn't be put through it again, and you just want to wait until he's old enough to choose, I think that's okay. I would probably have a little think before you go to your appointment at writing down your argument about why you feel it's not right for him, so that you can articulate yourself in a situation where you're going to feel pressured because it's not your environment. It feels sometimes a bit like, they're the god because they're in control, but they're not. This is your child. You are in control, but you can feel tricky when you know that they're pushing you for something else, but you just need to articulate clearly why you feel like that, and no one can make you do any different. And I think that's fine, personally. I think, we always have to just decide when it's right. And if it makes you feel any better, we will always weigh up in Southampton when we do food challenges, whether the child is going to eat the right amount of food to deem this a success. So they have to eat a relative amount of portion. And some littlies are never going to manage to eat tree nuts in the right amount of portion to say this is successful. And so we would quite often say, we think they've outgrown this, or they're not allergic, but actually we don't think that they're going to manage to succeed because they're not going to eat the right quantity, or for others, they're too anxious at this point in time, and we'll just say, we'll just leave it. We'll wait a few years. So we often do that and make that decision anyway. So there's nothing wrong with you as the parent making that decision. I hope that helps. I did see somebody post earlier that it was their first ever appointment and their child's reacted to peanuts, and they did, bless them, said, are they going to feed the peanuts and make them have them or not? It just made me chuckle, because we are actually fairly risk averse. Well, the allergists are. I would say I'm less risk averse because I'm a GP, so I'm used to taking risks because I've not got 100 colleagues to ask. I've got just me usually day to day. But certainly the hospital doctors are quite risk averse, so they would never put you in a situation where they're just going to feed you that thing in clinic. It would always be like on a day ward usually, or like in a real risk assessed environment. So, but I think it just shows that, until you've ever been to appointments, you don't know what happens. Just like the first time I rocked up for chemo, I had no idea. I'd never worked on a chemo ward. I've seen some like films. and pictures, but actually the reality was nothing like that. So yeah, so just do what's right for you, your child, really. That's all you can ever do. And I wish that in many ways I'd advocated for mine much more when they were younger, and I've been learning that lesson. So now I'm more pushy, and they hate me for it, but you know, you're doing it for good reasons. Right, I'm going to love you and leave you. I will not leave it so long next time. I will also be trying to do a few lives periodically on Instagram, so just keep an eye out. If you're on, follow both. You can sign up to our emails as well. I'm not very good at emailing, but I'm trying to get better at trying to do it twice a month. But we sometimes drop some emails with some like tips and things we've been learning and sharing and stuff. Oh, and the other thing we have on our new website, in the, I think it's on the more section, is a media page. But on that, I've shared all the like YouTube videos I've done with Anaphylaxis UK and random links to articles I've written sections of, but most of them are allergy based or papers. So have a little look at those if you get bored in the middle of the night when you've got people awake. Right. I do try and answer your questions periodically. I just can't answer them all, hence I come on here, but I will keep looking. And as I've got some time, I'll do some more. No worries. Good luck as well, Megan, with everything that's coming up. And just holler if, there's a question around immunotherapy. I'll see if I can answer it for you. Bye, guys. Have a good evening.